Welcome to the Institute of Pathology. This is where you find the histology and the cytopathology laboratories. This is where you will receive tissue samples and fresh fluids from patients and from primary care settings. Let's go and have a tour and see what happens inside. Okay, so now here we are within the laboratory. This is where we do the diagnostic, cytology, reception. You can see me behind me checking in all the samples we would receive from the wards in the hospital and from the outer primary care trusts. Samples that we would receive in here encompasses urine cytology, respiratory samples, from bronchoscopy, from sputum, from pleural effusions, from chest drains, and also these investigations are very complex, so it's vital that we would treat these samples and process them promptly because they're received in fresh. So here is me, just checking in the samples. So this is where we would process all the fresh fluids for diagnostic cytology. Here is Dean, one of our highly competent BMSs.
So what we've got here is a cerebral spinal fluid which is coming from a lumbar puncture of a patient that maybe has a suspected malignancy in their spine or brain. So what we have to do with this sample, it's a very small sample because of the there's not very much cerebral spinal fluid in a patient. So we would spin this down, get the cells out of it, put them on a slide, and then stain it up and examine it under a microscope to see what is in the sample and if there's any malignancies present.
Okay, so once we've got the cells onto this slide, in order to be able to see the cells, we have to stain them up with bright colour on this staining machine. So this goes in here. They get stained up and then they can be looked under the microscope for a diagnosis. So hi, here we are now in one of 3 screening rooms within the department. Here got with me is Julia and Louise, 2 members of the team. As you can see, they're at their microscope stations, just examining the specimens for any abnormalities that may be found within the specimens and highlighting any areas of concern that need to be brought further attention and need to be more closely examined later on by the consultants. Dr. Latchby?
Thanks, Maria. I am a pathologist who specialises in breast pathology, cytopathology and hematopathology. So I look at stained glass slides and under the microscope and provide a diagnosis on the basis of the microscopy findings. I would always correlate them with the clinical data available, and sometimes more work is needed.
Hello, I'm Christian Brennan, and this is the cellular pathology lab and your dissection. In dissection, I'm dealing here with a colon specimen, a sigmoid colon anterior resection specimen, which has a tumour in it, and we have serially sectioned the colon to demonstrate the tumour, and then we can see the extent of invasion of the tumour into the mesentery, that's the fat around the colon, and we can see just how far the tumour has spread and see if it's clear margins, and then what we can do is we can select the best areas of invasion of the tumour to demonstrate how extensive the spread of the tumour is and to stage the tumour.
So Belfast has a long and illustrious history concerning pathology, and we are glad to welcome you into our building. This is a quick synopsis of what we have to offer and what we deliver to the Belfast Trust and the surrounding area. Feel free, any questions or any queries, just to click on the link to follow, and we'll be happy to answer any questions. If you feel like this is an area of interest, maybe of future employment, or regarding any samples, welcome any questions. Thank you.